Hey everybody, Facebook Live. Here we are with our podcast every day at 1 o'clock. Today is Tuesday. I am excited. Well, it is a podcast because we're here. We're getting a little chit chat. Today's a big day for me. I just want everybody to know, feel free to share this. It's my 15th year wedding anniversary. Nothing been better. Best decision I ever made without question. And this quarantine has been great because now we go into our anniversary. Enough said. We just want to move on to some of the interesting things at hand. Every day there's such an influx of new information, going through it, dispensing with the information, trying to see what's most pertinent to share with you. So please feel free, like this, comment, share it. Go to Instagram. We're doing great on Instagram now. A lot of people are commenting there. But please comment, like, and share. Let me know what you think, because a lot of what you're asking for really depicts what I'm going to pick for the next day to discuss it. We're still going through, even though some of the states are open, we're still going to be going every day, try and give you the most leading edge information. Friday, we're going to have a really well-known surprise guest. So I'm going to announce that. I've been waiting for one more email back, and then I'm going to put it up on Facebook. You don't want to miss Friday if I get this guest on. It's unbelievable. I'm like a giddy little boy to have this gentleman on and have him share his knowledge bombs and be happy to come on with me. So having said that, let's dig right into it. Antibody tests. Oh my goodness. This has been the football back and forth without question. Everybody's kicked. You had to have it, then it didn't work, and then you did this, and we do it, and this, that. It's been a horrible back and forth. There's too many tests. This one's more accurate. This is the way to go. So here's where we're at. Everybody knows a PCR test, very simply, is a swab test. It tells you yay or nay. The antibodies tell you over a duration of time where you've been and what's been going on. So the two antibodies that are tested for are IgM and IgG. So typically, if you were to make this imaginary graph, the first 7 days, you're probably not going to have any antibodies. You're only going to have viral replication. Approximately day 5, actually 5.1, is the median time that people start to feel symptomology with COVID-19. At about day 7, IgM starts to pop up, and it goes like this to day 14 and drops down like this at day 21, classically. That doesn't mean every individual functions the same way. At day 14, we have this other guy called IgG. That comes up at day 14, goes all the way like this, and at day 28, in theory, is supposed to end. So approximately, it's a 28-day cycle. We all know everybody has different cycles. We all know everybody reacts differently. Those are our own immunoglobulins, which are immunoglobulins that we're really looking at. The two most important are antibodies. They're derivatives of immunoglobulins. IgM early, IgG later. IgM is much bigger, but it's not as potent. IgG is smaller. It's so small, it passes the placenta in the mom and obviously can get to the child. IgG is also very potent because it can actually block docking sites at ACE2 receptor sites. So we really want IgG. So some of the quick scenarios, we'll do it one more time. If you're negative like I was, negative IgM, negative IgG, that means I am what we're going to be talking about, very vulnerable. If you're IgM positive and IgG negative, you're in the first 14 days. If you're IgM and IgG positive, you're probably somewhere up to including the first 21 days. And if you're IgM negative and IgG positive, you're either at day 28 or further along. So that's why they say if you're IgG positive, no symptomology for a couple of weeks, you're probably okay. So here's what we're seeing now. So everybody's like, I got IgG, I'm like Superman. There's no kryptonite. Well, that may not be the case. Nobody's saying that you're immune. They're saying they think you're immune, and they think you're immune for a few months. There's no hard and fast rule. But what we do know is if you don't have IgG, we know that, like myself, that you're more vulnerable. So let me go over some of the data that was shared last night and this morning. By showing how many people haven't been infected, the tests provide a picture of remaining vulnerability to the coronavirus. So, for instance, in New York, we had the highest positive rate. We were at 21 in the city, and I think 14% like in the state. Other states, much, much less. In theory, everybody who doesn't have the IgG is more vulnerable, more susceptible. The antibody test tells whether a person's immune system has developed antibodies needed to fight off a particular infection. This infection that we're testing for clearly is COVID-19. Negative, as I said before, those who are the most vulnerable. The World Health Organization on Monday said, this was a statement, just because there's no evidence in this area doesn't mean there's no immunity. It just means that the studies haven't been done yet. So they just don't know. So you're really always, once again, looking at the IgG antibodies. An interesting factoid, and then if we have any questions, we'll roll into that, any shout outs, any comments. COVID-19, 19 states out of the 50 have been what they call tested enough or on track to be tested appropriately, since we should always test and not guess. On the converse side, 31 states are well behind the needed testing. If you want to find out the states, Harvard researchers put it up on STAT. So that's really the idea of the antibody test. Again, I recommend everybody test so we see where we are. Even though I'm negative, we're getting ready. We're picking what day or 2 days to go back to work next week. We're talking about it. We're fully ready to be geared up. We're going to get the check of the fever from a few feet. I'm going to have the mask. I'm going to have the splat mask. I have gloves. My staff will be masked. We probably won't take any cash. Not that we really get any cash. We usually get credit card, but we're not going to give any receipts. We're going to do all the things that are necessary, one patient at a time. The other patient will call on their cell phone, or they can wait outside. There's a tremendous waiting reception area outside where people can be more than 6 feet away if somebody were to wait outside. So that's where we're at. Did we have any shout outs or call outs? Good.
Happy anniversaries.
Well, yeah. Well, who said it? I'm curious. Thank you, Mike. Thank you, Dr. Powell. I appreciate it. I'm happy. Hold on one second. I'm sorry. I'm happy that you said Dr. Powell. As everybody knows, Creator Chiropractic every day is helping us. They're pushing people. We're working together. We're going to get Dr. Powell on again with us. We had him on with Dr. Brent Orville. But anyway, Creator Chiropractic, Medford, Oregon.
And Dave D'Angelo.
Hey, Dave. Thanks a lot. Coffee was good, man. Sorry, I used the cup this morning. It's my new favorite mug. So Mamie won't allow me to use a dirty mug. So this one's nice and clean. So I appreciate all the...
He said you're a lucky man.
I am a lucky man. It's true. I got lucky once, and she just doesn't know enough not to make me unlucky. So I'm very happy. All copacetic. I'm going to eat something that has like 5 grams of sugar today, just so everybody knows. So just 5. Because we talked about it yesterday, remember? If you eat too much sugar and you eat too much saturated fat, you elevate your innate immune system and you decrease your adaptive immune system. This came across, and I was astonished to hear this because I don't know how quick I'd be to take this stuff. Nevertheless, doctors in Long Island, New York, started treating COVID-19 patients with estrogen. Those are male patients, in an effort to increase their immune system. So we've talked about it before. We found out, well, why are women a little less susceptible? So many more men are getting sick. So many men are are passing away. What is it the women have that the men doesn't have? And it appears to be estrogen and estradiol, which is a very common hormone in women. So next week, the doctors in Los Angeles with the male patients are going to add progesterone. So the way a woman's hormonal cycle works is the first 14 days in a classic woman's cycle, they have an elevation of estrogen. From day 15 to day 28, they have an elevation of progesterone. Now, progesterone is a very interesting hormone in that it's known to be an immune-enhancing hormone. When women's progesterone goes too low, they actually technically call that luteal phase defect. Estrogen comes too high, there's some changes in personality. Essentially, what we refer to a luteal phase defect, a decrease in progesterone, we refer to that as PMS, or premenstrual stress. However, progesterone now is going to be administered to male patients next week in LA because of its strong anti-inflammatory properties. They are looking to potentially prevent harmful overreactions of the immune system. So they're looking to decrease that innate immune system once again. Men are doing much worse, again, as I said before, with the numbers in the immune system. 75% of hospitals' intensive care patients and people who are on ventilators are men. So it's a tremendous gender disparity. And that stat came from Los Angeles Cedars-Sinai Hospital. In China, the studies show that men died at much higher rates. They attributed that in China to smoking. Clearly, that could be an issue. Italy, they had higher rates. Men were double the rate in Italy of women. So having said that, it's going to be very interesting in these studies and all these hospitals that that are inundated with COVID-19 patients, which New York, California, obviously coming to mind most. Now, interesting, ACE2 receptors. So we've talked about that. The ACE2 are the receptors that are needed where the COVID-19 can cleave. ACE2 are very common, obviously, in the lung. They're common in the enterocytes, in the ileum, kidney, liver. They're also very common in the heart, and it's always damaged the heart with periocytes. So the ACE2 receptor is what this evil virulent virus has poked and wanted to attach to. The ACE2 is regulated differently in men than in women. That's what they've surmised to date so far. And the bottom line is estrogen, what they found, can reduce ACE2 expression in the kidneys. That was in a mouse study. So they've done it in mice for kidneys. They're trying it in humans because right now what we have is natural alternatives, supplements, lifestyle, which is a huge player. But once people are really sick, there are no vaccines that are preventing it, and that's a hot topic. We don't have to go into that. There's no drug yet that's come to the forefront that has shown to be effective to help ameliorate any of the symptomology or the myriad of symptoms that COVID-19 gives. So now we're talking at the level of IV for nutrients to help people, which has shown to be really good. And now they're talking about adding hormones to everybody, which is more, again, a more natural alternative than the more invasive things. Like I said, I'm not so sure if I'd be so quick to take them, but what the data said about it was very interesting in that they're only going to give it for a few weeks, so they're not going to have any characteristic changes. And without the characteristic changes, they are without question looking at outcomes and dimming the ability to stick to the ACE2 receptors. So that's quite exciting. More stuff coming out. I didn't want to talk so much about the blood clots. That's still up in the air. If that comes a little bit more to the forefront, we'll cover it. Once again, everybody should always take care of themselves every day. Did you eat well? Did you drink your organic coffee? Did you hydrate? Are you going to exercise? Did you take the needed supplements to keep yourself healthy? Did you consider your intestinal permeability, or did you consider not allowing to have intestinal permeability? Every day I have a conversation with a patient on telehealth, and it all comes up. And I can tell you this, that the patients that have done worse with their outcomes with any kind of illness are the patients that have a damaged gut lining. So if we don't have any shout outs, it's been a real quiet day. Tuesday's a quiet day. Mondays, everybody's raring to go. Tuesday's a little day off. Get ready for Friday, because I've got somebody really well-known coming on Friday. Did you?
No, it's also a beautiful day out.
It's a beautiful day out. I think a lot of people are getting to the point where they're going out. It's a beautiful day to celebrate an anniversary. We're getting a lot of work done, and like I said, we're going to have a little something with a little sugar. I promise I won't pump my glycemic index too much. So,
Dave wants to know, he wants a hint on Friday's guest.
The hint. A grandfather of something. And no, better yet, since I'm from New York, most people call it the father. We call it the godfather. So there's your little hint. I'll text you when we're done.
Andrew Johnson wants to know about blood types and COVID-19.
Yeah, Andrew, how are you? Thank you for asking the question. So the data is almost 2,200 people that in China that were studied, and find out that type O had a much better outcome than type A. So they don't know why, but that was what the data. We're data driven. So you do the study, you find out what it reveals, then you have to analyze why. And that's the crux. I was having a conversation with Dr. Powell, and what we enjoy so much is that we both want to get to the root cause resolution, and it's a soapbox time for me. Many people think that chiropractors don't do that, and that's not correct. If anything, we're highly versed in getting to the root cause resolution, and without question, chiropractors leaning towards nutrition and exercise rehab are very lifestyle oriented. So if you have any questions, feel free to reach out. I'm here. Even if I'm in the office 2 days a week, we're going to be seeing 2 to 3 patients an hour max. Patients are going to love it because I'm not walking out of the room. There's no place to go, and they don't have to hug and kiss me and shake my hand now. We can just say, how are you, in a safe, as safe a distance as we can. And we're good? Outstanding. Thanks, everybody. It's always my pleasure. We'll see you tomorrow. We're going to have some great topics to cover. Dr. Rob, always yours in health.